I mean, cardiac disease, classical, is what they call angina, chest pain or exertion. Someone is walking or running or doing some exercise, suddenly they feel pain. And the pain might not be the left side of the heart, it may be the back, the jaw, the left side of the arm. And most times it's pressing pain or cramping pain, like someone sitting on a chair. And it can be very severe, associated with shortness of breath and sometimes even with palpitations. And it is painful enough for someone to stop. And then when they stop, the pain will get better. When they start again, the pain will come back. So that is angina. That is not a heart attack yet, but the blood flow is already been blocked in the arteries. A sudden severe chest pain that lasts more than half an hour with sweating and all that, that is normally a sign of a heart attack or myocardial infarction. And that of course can be fatal, can be very serious. In fact, 50% of people who get heart attacks first time they actually die from the heart attack. So that is actually a medical emergency. So certain deaths that occurs, it could be, of course, one is myocardial infarction, that means a heart attack. People have heart disease, they're undiagnosed, and suddenly there's a plaque that blocks the artery and they get a sudden heart attack. Other causes of sudden deaths are irregular rhythms of the heart. That could be congenital, they don't know about. They suddenly get a what they call a ventricular tachycardia or fibrillation, then suddenly, the ventricular activity of the heart goes haywire. And that can suddenly stop the heart at any time. Conditions called focal hypertrophy of the heart, which they cannot diagnose. This especially can be seen in athletes who have undiagnosed hypertrophy of the heart and they exercise and they do sudden burst of exercise and then suddenly the heart will go to failure and stop. So these are some of the causes of sudden deaths that actually if looked at earlier can be prevented. I mean, I'm seeing younger and younger people getting heart attacks. When I first started medicine almost 40 years ago, to see anyone below 30 with a heart attack was never even think of it. Always 40 or above. But now I haven't seen a heart attack in an 18-year-old, which could be related to very poor lifestyle. Someone was very obese, was, had a very bad lifestyle. So it's younger and younger, and I think if you got a strong family history of heart disease, or if you got a lot of risk factors for heart disease, then you should, check even in the 20s and 30s to see whether everything is okay or not. I mean, once your heart disease is there, you will probably need medications. And a lot of times, heart disease just not just heart disease. We probably have underlying things like high cholesterol, high blood pressure, diabetes, and all the other things that are there. So most of the time, it's not only just medication to help the blood flow in the heart, to help the heart get stronger, but also probably need these other medications to treat the hypertension, diabetes, and the cholesterol. And it's going to be lifelong. Because I know patients who have really looked after they change their lifestyle, exercise, and control their diet and all that. They have been able to reduce some of the medication. But once you have the disease, it's already a lifelong treatment. So I think again it comes down to prevention. So once you have a disease, it's already that means you're no more in that wellness state. Some people think the difference between health and sickness and wellness. A lot of us are healthy, 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 but we don't do things to prevent disease, so we go into sickness. But wellness is different. Wellness is proactively doing things every day to prevent a disease. And it is simple, basic things, having a good nutrition like what the people in blue zones do. A lot of foods that are natural, fruit, vegetables, seeds, legumes, a bit of fish, chicken, very natural foods, food that come from nature. Avoid all sort of preservatives or all sort of foods that are full of toxins. So go back to nature. Exercise is very, very important, especially cardiorespiratory exercise, flexibility, some strengthening exercises are important. Learn to manage stress. Stress is something that is a killer. So and it's again the attitude towards stress. So learn to manage stress, make sure you have good sleep, and again very important is your attitude towards being healthy, towards wellness, towards taking care of yourself. And I always tell people listen to your body. Sometimes we do things, we just overdo things, we are working very hard, we don't listen to our body until it breaks down. So it's very important that we should listen to our body and do all the right things so that we prevent disease, especially heart disease. I mean, that's the exciting time that we are in now, that, we don't have, the technology that we have today is so interesting, I mean, yesterday I was sitting with someone with an Apple Watch on and he was telling me how he could check his blood pressure, he really could see the ECG rhythm on his watch, look at his sleep pattern, look at his heart rate, look at the oxygen levels. Just beginning, the future will get better and better, where our digital monitoring itself will be able to tell us a lot of things about ourselves. But I think we should make use of this technology to monitor, to know whether anything is happening. Once you pick up something early, for example, if your blood pressure is slowly going up, your heart rate is slowly going up, or you find that your sleep patterns are not good, then you can go and do something about it, reverse it before it comes into a disease state. That means now you're looking at prevention and wellness. Right now, maybe not yet, but I think there's a lot of focus on whether we can give you stem cells to repair the damage to the heart, not the arteries yet, but once you get a heart attack or for whatever reason your heart gets damaged, that means the heart is not functioning properly, using stem cells to regenerate the cells in the heart to make the heart stronger is definitely a possibility.